Hi, welcome to Mind Matters. Mind Matters is a show where we're really beginning to understand the impact of advancing technologies on society, culture, and us. I'm very pleased to have Dana Marshall here, CEO and president of a company called BacteriaScan. Thanks.
Happy to be here.
I'm really intrigued about your product. I want to know a lot more about it. But before we talk about the product itself and all of my trillions of questions that I have surrounding it, a great product, which yours is, solves an old problem. What's the old problem here?
Bacteria. Bacteria is the challenge. We've got to remember that that human beings are kind of a new intruder on a planet that's inhabited primarily by bacteria. And for all of human history, people got bacterial infections and they died. Over the last 100 years, we've finally figured out what bacteria are and how to provide therapies for people that get bacterial infection in the form of antibiotics. But the problem is that we've misused our antibiotics and the bacteria are winning. And so our challenge—
They become immune.
They become immune.
Yep.
They become resistant. So our challenge going forward is to figure out how do we manage the antibiotics that we have to maximize the result we get for healthcare and for agriculture and other purposes. How do we do that with the antibiotics that we have, because they're really hard to come by?
So historically, we've been using antibiotics quite willingly because we are uncertain of exactly what we had on our hands.
We didn't appreciate or didn't take to heart the advice that Alexander Fleming, who invented penicillin or discovered penicillin, he said back in the 40s, you've got to be careful that if you misuse these drugs, if you don't treat them properly, bacteria will become resistant and then the drug will be useless. And what we're living through right now is a period where the bacteria have figured out how to defeat most of our drugs. And so we're now in the struggle between finding new drugs and finding better ways to treat patients with the drugs that we have.
And this product is really a better way to determine if the patient even needs the drug to begin with.
It's a better way to find out if the patient will respond to the drug that you have,
Okay.
or to pick the right drug for the bacteria. Right now, the standard of care in a hospital, if you have an infection, they take a sample of some sort, they'll send it to a lab, and then 2 or 3 days later, they will have grown enough organisms and tested them to figure out which antibiotic is going to work.
So this is high school Petri dish?
It's literally the same as they've been doing
thing.
since 1882.
My goodness.
You smear it on a plate, put it in an incubator, come back the next day and see if anything has grown.
Gotcha.
That's the way the business works today.
And this is worldwide? This is
everywhere.
Everywhere.
This is in your
Wow.
fanciest hospitals. It's still the way things are done.
Okay.
And the problem is that if you've got a blood infection, a sepsis infection, or you've got meningitis, you'll be dead long before the Petri dish is showing up. So what they do is they go to the shelf and they say, we're going to give you drug number 1, drug number 2, drug number 3, and they watch you to see how you respond to the drug.
That's interesting.
And if your response isn't there, they go to the next drug down the line, which means that really, in effect, the patient becomes the diagnostic for the
Right.
selection of the drug. What we're focusing on is tools that allow the doctor to get a result back on the bacterial response to the drug within a few hours of collection of the sample instead of a few days.
And that's miles away from 2 or 3 days.
Absolutely. It allows the doctor to first make the decision as to whether he's going to treat you or not. For some types of infections, almost 85% of the samples that make it to the lab don't actually have a bacterial infection.
Okay.
So the first trick is, don't give the patient the drug until you know that they actually have an infection.
Require it. Yep.
People that go in with a cold, which is a viral illness, they're not going to respond to an antibiotic anyway, but they get antibiotics all the time.
All the time.
So the first thing is, let's find out if they've got an infection. Then once you know that they have an infection, let's look at how that particular bug and that particular patient responds to a wide panel of drugs. and then you pick the drug, the best drug for the patient at the right time.
So if you think of it as a funnel, in previous days, the funnel was this wide as you were trying to determine what was going on with that patient, and all we're doing is closing that funnel down so that we can more accurately understand what's going on
And
the
you've got to
inside.
do it in a fast enough time frame and at a low enough cost that the doctor is willing to give you 45 minutes to come up with the right answer.
Yeah, because the patient doesn't have a lot of time. If they're truly very ill, you need to attend to them right away.
If
So
they're really
time is
ill,
of the essence.
yeah, if they're really ill, time is of the essence from the patient's mortality standpoint. For a practicing physician, it's really a matter of their time. They have very limited time to deal with the patient, and doctors don't like to tell their patients to wait.
Right.
So the patient says, I want a Z-Pack, you give them a Z-Pack. And what we need to do is make it fast and easy for the doctor to say, here's a prescription for the Z-Pack. But before the patient gets to the pharmacy, he has to be able to call into the pharmacy and say,
Not so
don't
much.
bother with that Z-Pack. They
Yeah.
really don't need this. And that's a state that we think we can get to here in a couple of years.
So this is a general trend that I think we're witnessing, is we're getting better and better at diagnosing what's going on internally to people. There was an article just recently that Google's getting involved with a whole variety of medical technologies.
Right.
I want to learn more about how you invented the idea, but before we do, what is it? What does it do? How does it work?
I wish I could take credit for inventing this particular idea. Actually, I got involved through a St. Louis organization that invested in the company and is bringing the technology to the U.S. from Israel, actually.
Actually, okay.
So my job is to commercialize the technology. I wish I'd come up with it myself because it's really very brilliant. The healthcare industry, it's a fundamental need of human beings. And as the rest of the world gains a middle class, those people now want healthcare as well. And so there's a tremendous opportunity from a business standpoint to deal with human beings. A lot of human beings that
Globally.
get sick. Absolutely.
Yeah.
It's a huge financial opportunity,
Yeah.
which is why companies like Google have gotten involved. So let's go back to the question because I've forgotten.
How does it work? What does it do? So the traditional process is Petri dish, takes 2 or 3 days. This process is what? What happens? What makes it so fast?
What's happening in a Petri dish is you're taking a sample, you're putting it in a nice friendly environment where it can grow. It's got lots of nutrients and it's nice and warm. And it grows. And essentially you're counting the number of little colonies that grow on the plate. How many little blobs of tens of millions of bacteria are created. And the limit on that detection is your eye and your ability to see the little colonies on the plate.
So they put it under a microscope and they evaluate.
They look at it with their bare eye.
Wow, okay.
And you go 1, 2, 3
This
colonies.
does date back to the 1800s,
Absolutely,
doesn't
straight
it?
back.
Okay.
What we're doing instead is we're using a laser technique that measures scattering off of the little bodies of bacteria floating around in the fluid. And whenever a photon from a laser hits one of those little bodies, it bends just a little bit. And we look for the amount of light that gets scattered off those organisms.
That's pretty innovative.
It's really clever. And,
Yeah.
and one of the things that makes it possible and makes it practical, we have 3 really great technical revolutions in the last 15 years. One is very cheap, very reliable lasers. Another is very cheap, very reliable, very high resolution cameras. And your cell phone is, where those came from,
Right.
or what's driven that market. And the third is very fast, very cheap, very reliable computers. And those 3 things, you didn't have them 15 years ago. And what we're doing is we're taking a cheap laser, shooting it through a sample into an affordable, high-performance camera, and then we're processing the heck out of the values that come off of that camera in order to find these very, very small amounts of scattered light.
So if I'm just going to do some visualization here. Let's say I've got a jar of fluid that came out of me,
Yep.
right? You're in effect bouncing a laser off that fluid, and if it detects something outside of what would be considered just normal biological materials, water, whatever it may be, then it reports back to a software tool that's monitoring the effect that occurred.
It's exactly right.
So we can do that in a couple hours now.
Right. Well, actually, our instrument looks at a measurement about every 3 minutes.
Wow.
So we put the sample in the incubator, we watch it, and we plot out its growth. And we can see very, very small changes in concentration, and we can see them very quickly. So really, the time frame for our measurement to get a reliable, repeatable measurement is about 20 minutes.
What's always interesting to me is that the most disruptive technologies seem to come well outside of the field in which they're disrupting.
It's really nice to be an innovator in the healthcare industry, in the healthcare instrument and equipment business. There are incumbent technologies that have been around for 20, 30 years in automated microbiology. But the microbiology industry is heavily regulated. It takes a lot of effort to change a piece of software, to change a piece of hardware, to reprove or improve a piece of equipment. So what happens is a company will come up with a design, they'll build a machine, and then they will sell that machine for the next 20 or 30 years with minor changes for cosmetic and performance. But they never go back, because it's very costly to go back to the beginning.
It from the beginning.
And so we're in the fortunate position of having a blank sheet of paper.
Yeah.
And we're able to look at this in an environment where we can get cheap computers, where we can get good imaging sensors, and importantly, where we have the internet. So now we can have an instrument that we can have distributed out to doctors' offices, to small hospitals, to clinics, and we can port the data from those facilities
to a central facility,
so that a top-level microbiologist can interpret the result without having to transport the sample from, let's say, a country hospital to St. Louis in order to bring it to the big piece of equipment and the highly talented microbiologist that's going to interpret it.
You're referring to what they used to call telemedicine. We're going to get back to that because that's a fascinating topic to me. We're going to take a quick break. What better way to change the world than to change the human health condition?
I got no balls to losing.
He's in vaping.
Shocking drugs that road all the time. Just had a few drinks. Just can't be happening.
Are we clear?
Clear. We just buzzed. Just buzzed? You didn't tell us that, sir. You're right. This isn't happening. He'll be fine.
I feel good.
Really? No, not really.
Buzz driving.
Clear.
Maybe we should stop acting like it's no big deal.
Shocking?
They say that when you're facing extreme danger, your life flashes before you. If you think that's sad, consider facing it before you even have enough life to flash before your eyes. Car crashes are a leading killer of children 1 to 13. Deaths and injuries can be prevented by using the right car seat. Visit safercar.gov/the-right-seat to know what is appropriate for each age and size.
Look at me. Hey.
Raymond, look at Mommy.
Maybe the light hurts his eyes.
Maybe she's just not hungry. Maybe he can't hear us. Maybe we're not stimulating him enough. Maybe it's a phase.
Avoiding eye contact is one early sign of autism. Learn the others today. The sooner it's diagnosed, the better.
Hey, welcome back to Mind Matters. This is a fascinating topic. We are using medical engineering technology, we're leapfrogging technologies, and we're about ready, as usual, to change the world. Welcome back.
Thank you.
So where we left this is in the old days, and I don't even know if this is a current term or not, but it was called telemedicine, in which remote rural customers or even third world nation customers would have access to 21st century technologies without even leaving the beauty of their native tribe home or local residence.
Right.
Tell me a little bit more about how this device does that.
The first goal is, of course, to have an instrument that takes an accurate, cost-effective measurement.
And you're there.
And we're
You've got
there.
that.
That
Okay.
product is on the market today. The first product that we're making is actually the application for that is for the detection of urinary tract infection.
Okay.
And as we've talked before, most of the samples that make it up to a clinical laboratory that are urine samples are negative for bacterial infection. So our first goal is let's find the positives and get rid of the negatives so that our technicians aren't wasting their time plating negative samples.
And just as importantly, so that the attending staff, the doctor knows that he's not going down a path that's absolutely unnecessary.
Absolutely, to make sure that you're not treating with antibiotics a patient who doesn't have a bacterial infection. And if you have a patient that has pain or has some other symptom, to know that you don't need to treat the urinary tract infection because it's not there. There's something else going on with that patient. So that's the first goal.
Okay.
But then the ultimate goal for that is to take that instrument and apply it not only to the detection of infection, but to the rapid detection of resistant infection. So detect for that organism not only that there's one that's growing in the patient, the basic application, but also to take that same infection and treat it with with several different drugs and see whether it grows in those drugs or doesn't.
Responding or not.
Right,
Okay.
and that's a resistance test.
Okay.
And again, it's to tell the doctor as quickly as possible, here's a person, they have this infection, but don't bother giving them ciprofloxacin. They're resistant to that. You should move on to the next drug down the line, and here are 3 other drugs that will work.
Once again, to the funnel analogy, we're focusing down and getting a much more accurate retreatment.
Get to the right drug as fast as you can. Once you have those basic capabilities, if you've got a platform that is very reliable, very small, very efficient, and very cost-effective, moving that out to the doctor practice, moving it out to small hospitals becomes relatively affordable and easy business transaction for those organizations. It allows them then to test the sample locally rather than test it at the central
So
hospital.
costs start dropping.
Costs start dropping, right. And just making this cost effective for people is really important. Once you are testing the sample, one of the interesting things about microbiology is that these are living organisms. They are growing in their sample. So once you've collected a specimen from a patient, if it's got bacteria, they're growing and they're doing their thing. And you have to stop that long enough to get it to the laboratory so that you don't end up with a mess at the lab.
Gotcha.
Right? So you preserve the sample at the patient, or you refrigerate, and then you transport for 6 or 8 hours.
So now you have all kinds of costs that have just...
You have all kinds of costs, and you have a lot of uncertainty.
Right.
Now I don't know what's in the tube, really.
And
down the road.
human intervention being what it may, sometimes it might even be the wrong sample with the right name. And it happens.
Absolutely.
It happens.
Stuff gets overheated, stuff gets frozen, stuff gets lost.
Okay.
So the goal is, if we can move the test to the patient, then the sample doesn't have to get put into the car and shipped to the central laboratory. Similarly, for that little hospital, from a business standpoint, they don't have to ship their fee for doing that test to the central laboratory.
Right.
They get to make that. They get to make that reimbursement on their own facility.
Gotcha.
Which is
So
a
there's a
huge
business.
economic driver for the hospitals as well.
All right, so let's talk about the device once again, because my rude analogy of a glass full of liquid that we're bouncing lasers off. What does it actually look like, and how big is it? Is it big as this room?
It's an
or-
Xbox.
Is it really?
We worked with some great industrial designers here in St. Louis to come up with what I think is a really beautiful little design. It's a box about the size of an Xbox with a little door in the front, and the user's operation is push the open button, the door opens, take a sample, put it on the tray, press the close button, the door closes, you walk away, and that's
wait.
all there is. The instrument goes in, reads the sample, determines what the outcome is, takes the result, sends it up to a big database. The hospital information system then can go into that database, mine that result, and they've got their answer. And so
While the patient's sitting in the room.
while the patient's sitting in the room, or while the doctor is still contemplating what he's going to do with that
next.
patient, right?
That's fascinating. So where are you in the life cycle of the product? You've been in research facilities. What's the next step? What happens next?
So we launched a research use version of this box last summer.
Okay.
And we got a very strong response from a number of
I'm curious,
research
how
groups.
many boxes are out there?
We have about 20 boxes on,
Okay.
on the street
All right,
right
so they're
now.
beating them up.
Yep. Oh, they're out. They're doing exactly that. So
Yep.
we're learning those things that we need to do to improve the packaging and the handling of the box, and we're writing our operating manuals. Those instruments have gone out to research organizations that are using them to do this antimicrobial testing.
Okay.
They're trying to figure out for a particular organism that comes out of a particular patient, what's the right drug and the right dosage level that I need to give a patient if they're exposed to this organism.
Okay.
And our first project actually was done by the Center for Disease Control and Prevention down in Atlanta, CDC, and we ended up, surprising to us, in the anthrax lab at CDC, where they're looking at anthrax and the Black Plague. And the question is, if somebody shows up with a white powder, how do I know what antibiotic is going to be the best antibiotic to use against that
white powder?
That infection, an anthrax infection? What's the right drug going to be, and how much do I have to give the patient to get it?
That actually was going to be one of my next questions. Is it seems to me that where you started is just where you started, right? There is all kinds of applications for this
Absolutely,
technology moving forward, and not just for humans, right? We could be in the veterinary space very quickly.
We're looking at veterinary medicine for treating urinary tract infection in herds, but also for trying to detect mastitis in dairy goats, to try to look for contamination of bulk milk tanks so that you can de-quarantine food product faster. If you're a candy bar company and you're making candy bars, they will actually quarantine the product for 2 or 3 days while they're waiting for the swab results from their factory to see that their factory was clean when these candy bars were made. And that's a couple of day process.
That's expensive.
It's very expensive. Not only is it expensive to have to wait till Thursday to release the candy bars you made on Monday, but if you find out on Thursday that you had a problem on Monday, you've got to throw out Monday, Tuesday, and Wednesday. And you don't want to do that. You want to be able to fix those problems right away.
So where you're at is that you've just completed research. Are you ready to release to a clinical distribution out there?
Our first medical device is going on the market in May of this year. That'll be our formal product launch.
Congratulations.
Thank you very much.
And condolences. I'm sure that took a lot of
It's
work.
been a crazy couple of years,
Yeah.
and we've worked really, really hard to get to this point. That product is going out for this urinary tract infection detection application, and our goal is to go find good hospital systems that are looking for ways to improve the efficiency of their laboratory.
And test market.
And absolutely, and
Yeah.
learn how do we best fit into the hospital need.
But it seems to me the device, from what I understand, it could be simple enough that this can be distributed a lot of places. You don't necessarily need a highly technically trained staff to run it, right?
Not to run it.
Somebody like me could actually push the button, right?
Absolutely,
Yeah.
absolutely. It's a very straightforward piece of equipment.
And then with the bouncing of the data off the cloud, then you're really not asking for the technician that's actually feeding the machine to do the evaluation of the data. That's either being done in the cloud or coming back to the.
Absolutely. Once the
That's
data's
amazing.
Once the data's up in the cloud, we could have either staff microbiologists, or we could have expert microbiologists, or we could have very large, very smart computing systems look
Right.
at those results and come back with very good interpretations of what they're seeing.
Your personal doctor. One of the things that I've been watching for a while is the whole personal artificial intelligent mentor that monitors everything that's going on inside of you. So that's fascinating.
If you think about urinary tract infection, which we have the pleasure of thinking about a lot in our business, there are certain patients that are very susceptible to urinary tract infection. And when I look at a patient that is on kidney dialysis, a patient that is paraplegic and in a wheelchair, these people are very susceptible to urinary tract infection. They can get very serious, complicated UTIs. We see the potential here that an individual that's on dialysis should be checking their own urine on a weekly basis. And they don't have to be interpreting the result. The instrument can send the data up, and professionals and smart
So this
pieces
could
of
end up at
equipment can
homes.
do it. Absolutely.
Amazing.
Absolutely. Yeah.
All right, so we're probably running shy on time here. Before we conclude, where are you in your process? You're a relatively new startup. Where are you in the funding cycle? Are you still looking for funding, or?
We are. So our company was financed through large individual family investors or individual investors in St. Louis. We brought the technology here to St. Louis from Israel, from the original founders. We have raised through our Series A financing about $6 million from St. Louis investors primarily.
Excellent, that's good news.
It was really good, and
Yeah.
it was a very tough. It took a long time, and Midwest investors are very conservative people.
Right.
So we have been shown great support by the local community.
I'm glad to hear that.
Yeah, it's been really good. We have an opportunity to build a really substantial business for St. Louis. And the next step for us will be probably to go to a next round of financing. We're looking to bring that financing in largely from the coasts, from professional investors, venture capital, and private equity. But our goal is to build that business here in St. Louis.
Excellent, glad to hear it.
Yeah.
So we've got another success story here in St. Louis, and I'm very proud to hear that, because I personally believe that we're in the hotbed of some of the most entrepreneurial thinking that we've seen in a very, very long time. This is Mind Matters. We're changing the world. We'll have some information about this particular product on a website, and I sure hope to hear from you. Have a good day.